Hello, good morning. Welcome to my new channel where you and I discuss health. My name is Dr. Manu, a medical doctor with a passion to see you well, spiritually, mentally, psychologically, and of course, physically. Today, you and I will see how to diagnose diabetes. Always remember that all you and I discuss in this channel are intended to be informative only. This is not a medical consultation, nor it is a personalized medical advice. For all medical advice, my friend, please do consult with your general practitioner. Having made that clear, today you and I, having gone through what is diabetes, Type 1, Type 2, the signs and symptoms of them. In this video today, you and I will discuss how to diagnose diabetes. Please, I would like you to watch to the end so you can have a clue as to how to diagnose diabetes if you are living in a village or in an area where it is difficult to see a doctor. Please join me after the break. Welcome back and thank you for staying tuned. Today you and I, as promised, will see how to diagnose diabetes, especially type 2 diabetes. For many of the potential treatments of type 2 diabetes, an early detection is crucial. As a result, one or more techniques and tests can be used to diagnose the presence of type 2 diabetes. Number one, we can use glycated hemoglobin test, generally called A1C test. As mentioned, the test is sometimes called hemoglobin A1C or HbA1c or glycated hemoglobin or glycohemoglobin test. It measures the average of glucose in the blood over the last 2 or 3 months, as hemoglobin regenerates itself every 3 months, and it examines the percentage of glycated hemoglobin in the blood. The test measures the percentage of hemoglobin that is linked to glucose. The hemoglobin is a part of the red blood cell that carried oxygen to the cells. It's the main protein in the red blood cells, with A1C forming as a result of interaction between blood sugar and these red blood cells. That is, the amount of glucose that is present in the blood will attach to the hemoglobin protein, and increased glucose levels will reflect on the surface of the hemoglobin protein, thereby rendering a higher A1C level. The A1C test is not the most accurate as a blood glucose because it's not measuring the blood glucose directly, but gives a rough estimate of your blood sugar over all 3 months, which is really measuring the percentage of hemoglobin that is bound to glucose. The A1C result is reported as a percentage, and the higher glucose in the bloodstream, the more glucose will be tied to the hemoglobin, and the higher the amount of A1C. If your A1C level measure is below 5.7%, this is classified as normal, while in the cases where the result indicates between 5.7% and 6.4% is commonly considered as prediabetes. In an A1C level of 6.5% or higher in 2 separate tests is clear indication of diabetes. Despite its reliability in measuring the level of glucose in the blood, the A1C test can be affected by several other factors that we must know. For instance, those with blood disorders such as sickle cell disease and thalassemia could show a lower A1C than expected because their red blood cells have a shorter lifespan. Other disorders such as anemia can result in misleading reading of the test result and diagnosis. A study published in Armenian Biomedical Journal analyzed the effect of iron deficiency anemia on HbA1c levels in 120 diabetic individuals, found a positive correlation between iron deficiency anemia and increased A1c levels. Therefore, we see that people diagnosed with anemia can have increased A1c level. Therefore, knowing that can help us in our diagnosis of diabetes. Also, we need to understand that geographic heritage plays a part with people of African, Mediterranean, or Southeast Asian descent may have unusual forms of hemoglobin, which might produce falsely high or low results. We must also point out that certain kidney and liver diseases can affect the rate of rotation of red blood cells and lead to spurious A1c readings. Blood transfusion also could play a part in the accuracy of the result of the test. It's so important to understand that people that are always having blood transfusion, their test of A1c might not be accurate. Therefore, other tests might be needed in order to really diagnose their status. But in a whole, A1c test is a crucial blood test that can also determine how well a diabetic patient is managing the condition. Secondly, random blood sugar. What is a random blood sugar? A random blood sugar is a test carried to measure the levels of glucose in the blood. The normal range random blood glucose measurements in a non-diabetic patient is between 79 mg per deciliter to 160 mg per deciliter. If the random test is between 180 mg per deciliter and 200 mg per deciliter, the person is listed under pre-diabetic. However, if the blood sugar level is 200 mg per deciliter, that is 11.1 millimole per liter or higher, it may suggest diabetes, especially if there are other signs and symptoms of diabetes, such as frequent urination and extreme thirst. Thirdly, we also can diagnose diabetes by measuring the fasting blood sugar level. This test is also used to test the effectiveness of different medication or dietary changes on people already diagnosed as diabetic. The fasting test should be conducted in 2 separate occasions to ensure consistent results and to avoid a false reading. A nice public health guidance noted that the results of a fasting test with respect to glucose levels in the blood are, for a normal person, between 3.9 to 5.4 millimoles per liter. That is between 70 to 99 millimeters per deciliter. A prediabetes or impaired glucose tolerance between 5.5 to 6.9 millimole per liters, or between 100 to 125 milligrams per deciliter. Diagnosis of diabetes is 7 millimoles per liter. That is 126 milligrams per deciliter or above. Another test to diagnose diabetes is what we call oral glucose tolerance test. This test is more significant indicator of diabetes than the finger prick testing and is used to screen for type 2 diabetes, gestational diabetes, and prediabetes. To conduct the test, a patient may be asked to fast overnight or be asked not to eat or drink certain fluids for up to 8 to 12 hours ahead of the test. During the test period, the patient may be asked to consume a sugary liquid and their blood glucose level is then measured before and after at intervals after the fluid is taken. Khalifa pointed that the glucose tolerance test consists of drinking 100 grams of glucose solution and measuring the blood glucose values every hour to get a curve. The blood sugar levels are tested periodically for the next 2 hours to get the result. For non-diabetic, the test is under 6 millimole per liter in 0 minutes and below 7.8 millimole per liter in 120 minutes. For impaired glucose tolerance, glucose at 0 minutes will be between 6 to 7 millimole per liter and between 7.8 to 11 millimole per liter in 120 minutes. To diagnose as a diabetic, the result in minutes will be below 7 millimole per liter and more than 11.1 millimoles per liter after 2 hours. These are the tests that can be done to diagnose diabetes in the hospital, in a clinic. Now, what about those of our people in a village or in an area where there is no doctor? To have an indication that you probably have diabetes is to do this little experience that our forefather used to do. They will find a spot in their compound, and in the night, if they feel like urinating, as one of the symptoms of diabetes is frequent urination, they will wake up and go to the spot and urinate. If in the morning or after a couple of hours, they come and look at the spot and found out that there is a congregation of ants, that is an indication that the person might be having diabetes. That is the test that someone in a remote area where there is no doctor, no medical facility to help him diagnose the condition can do to have a clue as to whether he or she is suffering from diabetes. I hope that you and I in this short video have managed to understand how we can diagnose diabetes. This is Dr. Manu reminding you that your health will change when you start to pay attention seriously to what you have on your plate. I love you. Peace. See you in the next video.